Maureen Williams. Today is Monday, October the 11th, 2021, and this is Ask a Care Navigator, Mondays with Maureen. I'm happy to be with you. If you're joining us live or later and wish to have drop in any questions or comments, please do so. I really appreciate your feedback, and it's very helpful. Should you at any point have any questions in the now or in the future, live or later, about Four Seasons services or care navigation, please go to our website at www.fourseasonscfl.org, or you can call our office at 828-692-6178. And let me make sure I'm on the right page. And I'm delighted to be able to share with you today about our Four Seasons service lines, all of our services, not just care navigation. And again, please contact us with any questions or comments. We would be happy to speak with you in any capacity. And at the end of this, and I'm going to share it with you now, I have a document that I'd love to email to you. It's a wonderful document about our Four Seasons service lines. So if you want that, please call us at that number or go to the website and request more information there. Okay? Very easy. You don't have to put your email in the chat box for privacy. So we're very fortunate, Four Seasons, to be able to offer 4 primary service lines and a few other activities as well. So I want to start you off with a description of each of them and a little bit about each of them. And I'll start with care navigation. Certainly I know that one very well as I lead that service line. So what is care navigation? And basically it's help for people who want options and information for what is optimal and realistic care planning now and for the future. It's really important we take into account our clients' needs, their preferences, their finances, and their support structures. We've also been called geriatric care managers, or more properly now, our professional association calls us aging life care professionals. So that's what my colleague Teresa Tahu and I offer for you. What do? We do about 5 basic things. We help navigate our clients through the healthcare system. And to be honest, it's confusing to all of us who work in healthcare. So we know it's confusing to the rest of you, and we help navigate you through that. We assist with life transitions. Sometimes it's important to be able to move from living independently to assisted living, or assisted living to a nursing center support. Well, we can help with assist with those life transitions. It's very helpful to have a care navigator along for that. We help provide you with community resources. We are aware of a lot of resources in the community, and many of our clients teach us as well. And in fact, my colleague Teresa is well known for her ability to locate and engage community resources for our clients. So that's a big plus. We help with advocacy and planning. Sometimes it's important to have a care navigator along for those medical appointments to make sure that all the questions get asked and all the questions get answered and documented. Or we can help you with planning for futures, advanced care planning, and other future plans. We also help by educating you on your options. And we accept your choices, and I think that's very, very important. And in all of our services, we try to help provide a plan of care that helps answer this question for you, and that is, what is most important to you right now? Care navigation will help you with the what will be's or the what ifs, depending upon the circumstances. We will ask you lots of questions and hope to gain correct information in order to better help you and to make sure that you're thinking through your options clearly. And we are happy to meet with you anywhere and in just about any way. We're happy to meet in person, and we still do that, of course covered appropriately with our personal protective equipment. Sometimes we meet on porches, sometimes we meet in coffee shops. whatever is important to you. We're very able and willing to meet with you virtually, be it some sort of video conferencing or phone conferencing. We can meet with you and your loved ones or people that are involved with your life. We're glad to do it, whatever's important to you. And the reason we do this is because we believe that all of our clients deserve to receive the right care at the right time. And we will be your fierce advocates for just that thing. Our services are paid privately, out of pocket. They are not reimbursed by Medicare or Medicaid or private insurances, although some long-term care insurance policies have provisions for care management services, and that would mean you would pay us up front for those the services we provide, and then you would file that claim with your long-term care insurance company, and we're happy to do that with you as well. We're pretty skilled at that. We're also very fortunate here at Four Seasons because of a very generous contribution to be able to offer these services regardless of ability to pay from our Four Seasons Foundation. So we're so thankful to be able to do that, and we have done so for some clients. It's a real privilege to be able to help people in need, to be able to say, yes, we can help you. So that's a bit about our care navigation service. Again, go online, www.fourseasonscfl.org, and click on our services and select Care Navigation for more information. Our next service line that I would like to share with you is our Four Seasons Home Care Service. Some of you know that we purchased a home care agency in Hendersonville called Compassionate Home Care about 5 years ago. Well, we've completely rebranded that and redefined that as Four Seasons Home Care. And this is for people who need care for on an intermittent basis up to 24 hours a day with daily routine tasks. Private duty home care services, some people call it. Some call it home health care, but this is not skilled home health care. These are home care services, needs of a private caregiver. And the caregivers can help with personal care. They can help with other activities of daily living, such, that includes bathing and dressing, eating, feeding, toileting, etc. And they can also help with laundry, medication reminders, grocery shopping, running errands, and doing light housework. So we have some wonderful caregivers, and we're always looking for more. So if you're listening now or later and you're thinking of someone who might be interested in a position, please call us. We have some wonderful opportunities and benefits for our caregivers who work with us. This is available for whenever you or a loved one can no longer do it all and you need some additional help and support. We can offer services for as little as an hour up to 24 around-the-clock care. And we are all challenged right now with lack of caregivers, so please call us and we'll work something out with you as best we can based on your needs and our availability. And we have trusted caregivers. We can provide care in your private residence, wherever that may be, a private home, a condo, an apartment. We can come into assisted living facilities and skilled nursing facilities. And right now we're able to provide that care in Buncombe, Henderson, and Transylvania counties. It's very important to be able to reduce risks of hospitalizations or falls, and sometimes this improves quality of life. Many people will say, wow, I just wanted to try your services, but once you got in the door, I knew I needed you more, and have increased the time. This is a great safety measure to put into effect for your loved ones. And in fact, I know that our caregivers sometimes will even help with transporting to appointments and so forth. And sometimes that's just a bit of help that you need. So, who pays for this service? That's the exciting part. It can be reimbursed and paid for by long-term care insurance, and we will file the claim for you. How nice is that? And submit to the long-term care insurance company. It can be paid through private pay. We do have some contracts with the Veterans Administration. And just like Care Navigation, we are able to provide this through our Four Seasons Foundation, paying for services regardless of ability to pay. How exciting is that? We're very fortunate. And I need to tell you that Care Navigation Services, the availability range is Madison, Buncombe, Haywood, Henderson, Polk, and Transylvania for right now. But we're working on virtual options as well. So care navigation and home care services, we can coexist together. The next service line that I would like to share with you is our palliative care service line. And I was just checking to see if anyone had dropped in any comments. Feel free to drop in comments now, live or later. And again, I'm going to direct you to our Four Seasons website, www.fourseasonscfl.org. Click on services and click on home care services. And you can learn a lot more about our services there. Our third service line about which I would like to speak is our palliative care service line. And this is for people living with serious illness who are still seeking curative, life-prolonging treatments. Now, name a serious illness. There are lots of them. Parkinson's disease, heart failure, a heart attack, pneumonia, cancer, lots of dementia. Lots of serious illnesses that may not necessarily mean that you're at the end of life, but you want that additional strong clinical support on your team. Well, that's the beauty of palliative care. It's a holistic approach to care that coordinates with your primary care and your specialty care physicians and providers. You will receive a clinical evaluation and additional supportive care with our social workers and our nursing services. My colleagues in palliative care are experts at pain and symptom management, and they are experts at assisting you with advanced care planning. This is the specialty of palliative medicine, and it's provided by physicians assistants, and nurse practitioners. You see, it's a specialty service, just like going to see other specialists like a cardiologist or an endocrinologist. It's specialty medical and health care. It's valuable. I think it's very valuable when you've been diagnosed with a serious illness to kind of help you look at the whole big picture of who you are. And that's just an incredible, invaluable, what I call a safety net of support for you on your team as you progress through and deal with your serious illness. And it's very person-centered. It's all about you and those you love too, which is very unusual from just going to sit in some sort of clinical office. Very helpful. So where is palliative care provided? Well, we can come to the home. And the initial palliative care evaluation, regardless of where it is about an hour in length. Can you imagine that? How wonderful it is to have a clinical person, a physician, a physician's assistant, or nurse practitioner listening to you and talking with you for an hour. We also have care in clinics, both in Buncombe County, in Henderson County, and in Macon County. Very exciting there. We can provide these palliative consults in assisted living facilities, almost all of them in our 13-county service area. And also nursing facilities, again, almost all of them in our 13-county service area. And we have palliative care teams embedded in 3 hospitals. Four. I think 4 in our service area. Forgive me if I'm wrong, but I know for sure it's in Advent Health, Hendersonville, Pardee Hospital, Haywood Regional Medical Center, and Harris Regional Hospital. So that's pretty exciting, isn't it? It's wonderful. We can come and talk with you. And the goals are really to increase your quality of life, reduce your symptom burdens, provide support to your family, and help you, all of you, clarify your goals and what's important to you. We help with that advanced care planning and documentation about that. And we also facilitate complex decision making. And that's really a lot of times where I, as a care navigator, will refer my clients to palliative care to help with some of those complex decisions. Very important to have that kind of clinical expertise in your team, on your team. Now, who pays for palliative care? Commercial insurances do. Medicare does. Medicare Part B. Medicaid does. Your medications that our providers might prescribed or covered by your insurance or Medicare Part D. Also, some people pay privately, and because of our Four Seasons Foundation, we are able to provide this care regardless of ability to pay as well. It's exciting. It's exciting. It's a privilege. Now, our final service line, some of you may know a lot about, and that is Four Seasons Hospice Care. We are very fortunate to have been providing this care for over 40 years. And hospice care is a very specialized form of palliative care at the end of life. It's for when people would have a life expectancy of 6 months or less. So let's say, by St. Patrick's Day next year, you wouldn't be surprised if your loved one or you were not here. You're eligible for hospice care. And it's just so comprehensive. It's not curative in nature at all. It's for those who are seeking comfort and quality of life. We provide nurses for case management. We have on-call nurses. We have nursing hospice aid services. We provide pain and symptom management. We have tremendous social workers who help you with identifying community resources and making plans. We have provide durable medical equipment and medical supplies to help you with your care, as well as medications. And you have access to music therapy, a powerful tool, other additional spiritual care and support, chaplaincy services, and volunteer support. Because by this time, your world gets pretty small, and volunteers bring in the outside world to you. Hospice is appropriate when you have been diagnosed with a serious progressive illness, a serious illness, and for which you would expect a lifespan, a prognosis of 6 months or less, and you're not seeking curative treatment anymore. And your Medicare hospice benefit is good for 6 months, but it's 6 months from a snapshot in time. If you've been with us for 6 months, we don't cut you off. It's a 6-month snapshot in time. And unfortunately, far too many people don't take advantage of this early on. The number one comment that all hospices in the country, including ours, receive after the death of loved ones is, why didn't we do this sooner? Why didn't somebody tell us about this sooner? So if you begin to see some decline in your loved ones and you're thinking, I'd be surprised, contact hospice. At least have the conversation. So where is hospice services provided? Home is the number one place where hospice is provided, be it a private residence apartment, assisted living facility, a skilled nursing center. It's wherever you or your loved one calls home. We also provide care at our inpatient facility for those who have acute symptom issues, and that is called Elizabeth House, and it is in Flat Rock, North Carolina, and we're going to be opening another inpatient unit in Franklin, North Carolina. We hope by the end of this year and perhaps early next year. A wonderful facility called the SECU Hospice House. Beautiful place. This hospice care is provided in all the 13 counties of Four Seasons service area, and you can really expect a lot of support, not just for your loved one, but the person who's going through this end-of-life journey, but also for anyone who's considered family to that person. That is why I think hospice is the Cadillac or the Rolls Royce of healthcare, because it's for every member of that patient's or loved one's family or circle that is important to that patient. We are experts also in managing pain and symptoms and medications that go along with that. We're really experts at providing comfort care. We facilitate those complex decisions making as well. And we offer grief services and support, not just in preparation for the loss of your loved one, but for up to 13 months after the death of your loved one, because that's going to get you through the significant firsts. And grief services are free. How is hospice care paid? Well, it's paid through commercial insurances, Medicare Part A at 100%, Medicaid at 100%, private pay through the VA benefits as well, TRICARE at 100%, and also through our Four Seasons Foundation, because we provide hospice care regardless of ability to pay. That's a lot about our Four Seasons service lines. Care navigation, home care, and palliative care can all coexist together. Care navigation, home care, and hospice care can all coexist together. You don't have to be on care navigation to be on hospice care, and vice versa. We give choices. Hospice care and palliative care do not coexist together. So those are some nuances there, but we'd be happy to talk with you and help you sort that out as you're making decisions. And we do that every day here at Four Seasons, the care you trust. So, for any more information about any of our hospice service line information, our palliative care service line, our home care service line, and our care navigation service line, please call us at 828-692-6178 or go to our website. A whole lot of information is there waiting for you at www.fourseasonscfl.org. And if you would like to have a copy of this very succinct of this document that spells out all of our services, the who, what, when, where, whys, and how much, just go to the website or call us and let me know your email, and I will be happy to send one to you. So thank you for joining me today on Ask a Care Navigator, Mondays with Maureen. And join me next Monday, October the 18th, for another session of things that are important to all of us to age well and live well. Have a wonderful day, and thank you.